Hello everybody, we have an excellent group of questions today, and for those of you that are wondering if you missed last week's FAQ, you did not. My customer service department posted that I would be posting, and I was on a family vacation, so sorry for taking a week off. I have all of your questions from last week covered in this week's video. So we have loads of things to go through, so I'm going to try to stay as efficient as possible and answer your questions. Okay, first and foremost, is there a good supplement replacement for Cavanase PM because the product has been discontinued? So Cavanase PM is a product made by a company called Neuroscience, and it's probably the best natural sleep aid I have ever seen in 15 years in practice. However, it contained one ingredient that the FDA banned, and the reason they banned it is because it's a prescription in other countries, and it's not a prescription here in the US, although you can't get it by prescription because it's 100% natural. So what the FDA did was they threatened for a while to ban this ingredient, and then once they did, what they ended up doing was removing all the supplement from manufacturing. So the replacement to Cavanase PM is called Alpha GABA PM. It's made by the same company, Neuroscience. So one thing I talk to people about when it comes to sleep is having healthy cortisol levels is very important. And taking magnesium, especially highly absorbable magnesium, like magnesium glycinate, helps to shut down cortisol at night. So when you take magnesium, you should take it at night, and it tells your nervous system to calm down. We know magnesium is used by bone, muscle, and nerve tissue. So magnesium isn't a sleep supplement. It's more of a nervous system supplement. So when you combine magnesium glycinate with valerian root passion flower, which has a calming effect, and theanine, which is an amino acid, it can really help promote sleep without causing grogginess, although it's not a sleep aid or a sleep supplement. So to help sleep, I'm always recommending magnesium first and foremost. If you need to do a 24-hour cortisol test or check melatonin production, those are great things to do, because melatonin is a sleep supplement. It will help you fall asleep, not stay asleep. You need enough dopamine in order to stay asleep. So sleep is a major issue that many people struggle with, and you have to get to the root cause. And Cavanase PM, without a doubt, was the best thing manufactured naturally. It no longer exists. We thank the FDA. Alpha GABA PM is the replacement for that, but don't forget about magnesium and cortisol and serotonin and dopamine and melatonin and all those important sleep hormones. Moving on, I have a rash on my legs and have my dermatologist and functional medicine doc stumped. Major problem this time of year. I will explain why in just a second. You've had household chemical testing, food allergy testing, steroid creams, oral steroids, no testing that is conclusive in determining what this rash is caused by, but the rash does show histamine within the rash. Histamine is really tricky because sometimes our body is overproducing histamine when you have SIBO or small intestinal bacterial overgrowth. Mast cell activation syndrome is associated with high levels of histamine. And we know with mast cell activation syndrome, predisposing factors are environmental allergies or your environment, especially if you have mold exposure. Another factor is having leaky gut syndrome, because then what's going on inside your gut is getting into the bloodstream, creating inflammation there. That's where things like SIBO play a part too, because small intestinal bacterial overgrowth releases histamine, and anytime you eat foods that are high in sulfur, it tends to make that histamine bomb go off. So using natural antihistamines can be very beneficial, as well as using things that block the overproduction of histamine. I think the product is called Hista-Ease, made by Designs for Health. A lot of docs that put information out on mast cell activation syndrome are a big fan of this. You got to be careful that you're not eating a lot of fermented foods when you have rashes like this, such as bone broth, vinegar, wine, beer, kombucha, kimchi, because fermented foods can create more histamine. So taking natural antihistamines, using something to keep you from overproducing too many histamines, but also testing things such as mold toxicity, testing for mold in your environment. And last but not least, doing a stool analysis so you can see if there is leaky gut. You can do a breath test to see if there is SIBO. Those are some things that I would suggest. And testing for leaky gut through zonulin or through LPS testing. So moving on, the best top supplements for Epstein-Barr. Ooh, I talk a lot on Epstein-Barr virus privately with my clients, but I don't get a chance to talk about it a lot on videos. So one of the best things for Epstein-Barr virus is lysine. So lysine is an amino acid that has a great natural antiviral component. The other thing would be to use something that is liposomal, that has a biofilm disruptor and is antimicrobial. I really like liposomal biocidin for this. That doesn't replace lysine. I still always use lysine, and then I may incorporate a liposomal biocidin. I use a protocol by a company called Byron Naturals. They're a homeopathic company. I think they're out of Colorado. They have a great Epstein-Barr virus protocol as well that I'll use if I'm counseling somebody under my watch. So, does the timing of vitamin D supplementation affect absorption? No, it's not about timing. Vitamin D is a fat-soluble vitamin, so you want to take it with a meal containing fat. Or if you take any supplements that contain fat, like a fish oil, it's great to take those two together. I'm going to combine two questions here because going down the list, somebody put, my doctor recommended K2 supplements for bone and cardiovascular health. I just read some articles from the National Institute of Health, which show evidence-based research backing it. How do I feel about that and what I consider supplementing with K2? So you can get, I use supplementation called K-Force, which is D3, K2 combined. So we know vitamin K, K2 specifically, helps the absorption of vitamin D3. So if you use a D3, K2 supplement, which Metagenics makes, Orthomolecular makes, or use one called K-Force, which has a little bit more vitamin K2, and you take that with a fat-soluble meal or a fish oil, you have all your bases covered. Okay, vitamin K is primarily found in dark leafy greens, which are also very rich in folate. So that moves us to the next question, which goes hand in hand. I have MTHFR. I was given L5-methyl tetrahydrofolate and methylcobalamin. It is lowering homocysteine. Before, my homocysteine was an 8, now it's a 4.8, too low. So it sounds to me like you're over supplementing. If your homocysteine is an 8, it does not require high dose methylfolate and high dose methylcobalamin. Between 6 and 8 is the sweet spot. You don't actually want your homocysteine to get too low, because what your body does with homocysteine is it uses it to make glutathione. Glutathione is one of the most potent, one of the most important antioxidants and detoxifying agents that your body makes. So your body makes glutathione. Sulfur-rich foods tend to, and things that contain N-acetylcysteine, sulfur-rich foods, broccoli, cruciferous stuff, eggs, as well as N-acetylcysteine help your body to make more glutathione. So it sounds to me like you're over supplementing. You may want to just go on like maintenance dosing. So I use Phytomulti by Metagenics. One pill has 400 micrograms of methylfolate, 2 pills has 800. Usually that's enough to maintain healthy homocysteine levels. If you go much higher than that, you're actually driving them down, and you don't want to drive yours down any lower. Next question, what are the best injections for pain relief for the hips? I really can't answer that. It's a matter of what is creating inflammation in the hips, right? Do you have high levels of inflammation? Do you have a high C-reactive protein? Because if you have a high C-reactive protein, I'm going to use turmeric all day, every day. I also use omegas combined with turmeric to help bring down C-reactive protein. I'm a big fan of the right types of collagen. I really like collagen by Orthomolecular because it contains 3 active types of collagen, and Metagenics just came out with one. I forget the name of it, but it actually combines collagen and turmeric together. So that's what I really like to use for hips. I use glucosamine, chondroitin, I use MSM, I use Thea. These are all things I use for joint health. So for hips, I use this pack of supplements called Wellness Essentials Active. I combine that with some turmeric on top of that. And then if injections are really, really needed, some natural injections that people do well with are stem cell injections, PRP injections. So those are definitely options. I know a lot of people are using hyaluronic acid injections, but you can actually take hyaluronic acid orally in a collagen supplement, which hyaluronic acid is in those 2 collagen supplements that I mentioned. So if you're actually getting injections, PRP, stem cell, but also I have had people in the past do really, really well with prolotherapy, which is injecting proteolytic enzymes to help create inflammation, to help heal the tissue within the joint. So I would probably talk to somebody that does natural injections and get their take on it. Love this question. What can I do to help stop sugar cravings? Stop eating sugar. Sugar is 7 times more addictive than cocaine. 7 times more addictive than cocaine. So if you're eating sugar, you're going to crave sugar. What you can do, drink enough water without artificial sweeteners, because artificial sweeteners, or if you always have to have sweetened drinks, flavored drinks, it's going to make you crave more sweetness. If you're using artificial sweeteners, you're going to crave sugar. Another thing that's going to affect sugar cravings is if your blood sugar is unstable. So it's important that you eat protein with vegetables, with healthy fats every 2 to 4 hours, or you don't go more than 4 hours without eating protein. There are some things out there that help with cravings. One is called Crave a Rest. It's made by Designs for Health. I love, love, love using meal replacement shakes like Ultra Meal Advanced by Metagenics. They make a great chocolate flavored one. It's sweetened with monk fruit, has plant-based proteins, branched chain amino acids. But you got to think about what you're craving. If you're craving sugar, usually it's because blood sugar is unstable, or you're consuming something that's making your brain have that craving. Almost always why. So when I properly evaluate someone, I'm looking at those factors. Also, if you haven't done a detox, do a detox. If you haven't done a detox in a while, it's time to do a repeat. I recommend you detox at least once a year. So moving on, love this question. It's about Barrett's esophagus. Was wondering if you had any good resources for healing the condition. Really, I think it's important to get to the root cause. If you're going to approach Barrett's, I think you need to have a food sensitivity test to find out what foods you're eating or drinking that are creating excess inflammation, as well as eosinophils possibly in the esophagus. A second component is maybe doing a breath test for SIBO and also testing for H. pylori to make sure you don't have a bacterial infection in your stomach. That's really the root cause of the issue. But as far as what's the best thing for it, I'm a huge fan of L-glutamine. Ideally, if you combine powdered L-glutamine with deglycerized licorice and a little bit of aloe. That's in a product called Glutagenics by Metagenics, or in a product called GlutaShield by Orthomolecular. So those are products that I love. You mix it in water. These are not pills. You mix it in water and you drink it. Also using digestive enzymes before you eat. Pancreatic enzymes are probably your best option, which is amylase, protease, and lipase. I don't think I would be using anything with betaine or pepsin or HCl if I were you. So that's a great option. I personally drink a shake for breakfast called Inflammacore, made by Orthomolecular. And within that shake, it's got some turmeric, and within that shake, it's got some glutamine. So I do that as a preventive measure. That's more for prevention than it is if you officially have it. Next question, can probiotics really help cure chronic rhinosinusitis? No, probiotics will not cure this. I've covered this before. 90% of sinus infections are fungal in nature. So if you're using a nasal spray, you can use a colloidal silver nasal spray. You can use a nasal spray that has xylitol in it, which is antimicrobial. My protocol when I'm working with this is I give somebody Candibactin AR by Metagenics because it actually works it's a natural antimicrobial agent, and it helps with yeast and fungus as well as bacteria. The best probiotic for sinusitis would probably be Ultraflora Acute, which contains Saccharomyces boulardii, because Saccharomyces boulardii is great for yeast and fungus, which is what 90% of these infections are caused by. But just a good old broad spectrum probiotic, probably not going to do it. Moving on, if a food sensitivity test comes back negative for gluten or dairy, should they still be avoided? Ooh, I love your question. For dairy, is raw best if we have access to get it from a local farm, or can we just do RBST-free milk and cheese? For gluten, should it only be organic sprouted wheat? Oh, good questions. There's no benefit to eating gluten and dairy. None. One is very inflammatory, one is very acidic. So no, I'm never going to recommend eating them, even if it's raw, even if it's organic sprouted. It's just not a great idea. If you're going to do it anyway, then yes, if you're going to eat wheat anyway, which I'm not recommending, then organic sprouted or organic sourdough would be best. The problem with bread or gluten isn't the gluten content in our food is so much higher than it once was, because bread used to be hard as a rock within 1 to 2 days. So even if you get organic sprouted or organic sourdough, it can still sit on the shelf or in your pantry for a few weeks without spoiling, going bad, or getting hard. That's a problem, because the process, wheat products or breads used to be made very, very slowly, and they would go bad very, very quickly. So in that slow process of making it, whether it was fermenting it or sprouting it, most of the gluten was broken down. So when you would eat bread, that bread had a low gluten content. Where now, when you eat bread, it has a high gluten content. So wheat-based foods have a higher gluten content than they had 20, 30, 40, 50 years ago. So keep that in mind. I'm not going to recommend it. If you're going to eat it anyway, there you go. You have my opinion. Same is true for dairy. If you're going to eat it anyway, I do think that goat milk products are better because the casein protein's bigger. And the bigger the protein, the harder it is for it to get into your bloodstream. Same is true when you ask about raw. The thing with raw is, yeah, there's a risk if it's unpasteurized that it could contain some bacteria that could make you sick. But with raw, it's unhomogenized. So back when milk used to be separated, cream, milk, that separation was because the milk protein was so big. When milk proteins were big, it was hard for it to get from inside the gut into the bloodstream, where it would create more inflammation. So is it better? I mean, it's kind of like, I'm not saying it's good, but it's a little bit easier on the digestive tract. And I think when you do look at dairy, it's intended to be a condiment, like ketchup or barbecue sauce or salad dressing or mustard. It's not like a major food group. It's very acidic, it's mucus producing, it's inflammatory. Milk is very high in sugar naturally, and when you go into the lower fat milk categories, what's crazy is you remove the fat, but the sugar content actually goes up. So fat's not the bad guy, it's really just inflammation that's the bad guy. So if you're gonna do a little bit on occasion, I answered your question. Okay, can you talk about fibromyalgia? How do you know if you should talk to the doctor? What causes it? There is no specific cause. Fibromyalgia is one of those things that is has a lot to do with trigger points and nerves being irritated. Nobody with fibromyalgia does well on a certain protocol, or if they get a diagnosis. The thing with fibromyalgia is you cannot approach it like a one-size-fits-all approach. I definitely put people on anti-inflammatory diets and protocols. Totally gluten, dairy-free, ideally grain-free, refined sugar-free, such as a paleo or autoimmune paleo type diet. Definitely do a detox with those people. I use ultra clear pH to help alkalize their system. Without a doubt, I do that. Significant amount of magnesium, significant. I'm usually doing, magnesium glycinate, 200 milligrams 2 times a day. In those cases, some people do really well with arginine because arginine helps increase nitric oxide production in muscle tissue. In some people, not in all. You want to make sure that those people are definitely consuming enough protein in their diet. They need those branched chain amino acids in order for the muscle to get the nutrients it needs to rebuild and heal properly. Sleep is so important. Hormones are important. Looking at cortisol levels, cortisol is particularly important, but looking at testosterone levels in someone like that. Looking at inflammatory markers like C-reactive protein, vitamin D levels, iron, ferritin. This is so complex. I've been working with fibromyalgia for 15 years. I love working with people with fibromyalgia. It just is not a one-size-fits-all approach. And I think you should talk to your doctor about it, but I don't think getting a diagnosis really gives you solutions to managing it. You really have to get to the right root cause. And that's where I love sensory deprivation tanks or float spas, because you literally soak in thousands of pounds of magnesium salt, which is great for muscle tissue, or you can do Epsom salt baths at home. I'm a huge fan of not just using turmeric, but turmeric with ginger and frankincense, or boswellia, because boswellia really is great for nerve pain, and nerve pain is definitely involved in someone with fibromyalgia. From a treatment standpoint, chiropractic, without a doubt, even combined with acupuncture. Those are going to be very effective physical tools, and I have seen so many people succeed with fibromyalgia. I just absolutely love it. Love working with people with fibromyalgia. Not that I love that you have it. Okay, last question. Then we're wrapping up. I had a mom ask that if she has bacterial overgrowth, is that bacteria getting into her breast milk if she's nursing? No, it's not. Small intestinal bacterial overgrowth is contained to your small intestine. If you have leaky gut, it's leaking into your bloodstream, not into your breast milk. So there's no reason to stop nursing if you have small intestinal bacterial overgrowth or any type of dysbiosis. Absolutely not. So thank you guys for watching. I know that was a longer video. I try to keep them to a certain time frame because it helps with our watch rates. We are going to be doing more videos on, we're getting a lot of questions on H. pylori, so we're going to do a whole video on H. pylori because that's going to take 10-12 minutes. So thank you for watching. If you're watching on Facebook, click the 3 little dots at the top of the video and turn on your live notifications. And if you're watching on YouTube, make sure you subscribe to our channel. We do have a library within YouTube that's more topic specific that we're not able to do through Facebook at this point, but stay tuned. What I will try to do, I know I mentioned a lot of supplements. I would love to give you a link for every single supplement that I talk about every video, but it's a lot of work and it depends on the questions you're asking. But I'll have posted in the comments section a link to a warehouse where if you do want to order any of the supplements that I'm talking about, you can order it right from that warehouse, because I did talk about multiple brands today, not just, one brand. I will put a link in for the warehouse so you guys can browse and see where you can get some of these supplements that I talked about today. Thank you. It was a pleasure. I'll see you guys next week.